Dr. Kenneth Looi. I'm a consultant pediatrician from Columbia Asia Hospital, Cheras. Today, I'll be answering a few questions that parents raised to me during the clinic sessions regarding COVID-19. Well, the answer is no. However, the symptoms reported in children are usually milder compared to adults. The common symptoms are fever, cough, running nose, but vomiting and diarrhea has also been reported. Well, based on current available evidence, children do not appear to be at higher risk as compared to adults, and also patients with underlying medical problems, such as bronchial asthma, disease, etc. First thing is to follow your asthma action plan that has been discussed with your pediatrician. Use your inhalers regularly. Do not forget to use your preventer. Every child will have different triggers: cold air, cold drinks, pads, smoke. Avoid the triggers as usual. Very importantly is to stay home so that you do not contract with any other sick people. Maintain social distancing and to maintain cleanliness in your house. There's something that I would like to add on in terms of cleaning and disinfecting your house. There are some disinfectants that can actually trigger an asthma attack in children because of the smell, the alcohol content. So it is best that the disinfection job is to be done by someone who does not have asthma, or when the patient who has asthma is not in the same room. Cleaning with soap and water is equally effective as compared to using your disinfectants. Lastly, monitor the symptoms carefully. If there is any symptoms to suggest that the child is having an exacerbation, bring and see a doctor. We are dividing the patients into two groups. Well patients who are coming for their follow-ups, vaccinations, they are well, they are not sick. And the second group is patients who are unwell. So at the screening counter and in front of the lobby, the patient will be screened. The temperature will be taken, questions will be asked. If you are having any symptoms of unwell, fever, cough, or running nose, vomiting, diarrhea, you go straight to the emergency department. There is a designated area where the medical officer will see you. If you do not have any of those symptoms, pass the screening test, the questions, then you proceed to the clinics. At the clinics, the clinic staff will ask you the questions again to reassure, and if you pass those questions, then you will see me in my clinic. But if you're unwell, the medical officer will decide whether or not it is safe for you to go to the clinic. If he thinks that it is safer for me to see you in the ER, then I will come to ER to see you. The dilemma is between getting the vaccine, which we know is very important to prevent dangerous infectious disease, and the risk of contracting the virus when you're coming out of the house. Generally, what I try to do is, for patients less than a year old, I'll try to follow the vaccination schedule as much as I can, with some flexibility of delay for 1 to 2 weeks. It's more than a year old, we will reschedule it. This case-to-case basis, discuss with the pediatrician and see which vaccines are the ones that need to be done earlier, which are the ones that can be delayed. Very importantly, the mask has to be worn properly. Children being children, I do see a lot of children touching their face, their mask, because it's uncomfortable. Ideally, when you wear a mask, you're not supposed to touch the mask because it's dirty, and then you touch your face. That's actually increasing the risk of transmission. Parents, as much as possible, stay at home so you don't have to wear a mask. If you're coming out where you need to wear a mask, then keep an eye on your child so that they do not touch the mask and touch their face. This is a difficult time for all of us. But I think if we unite and we cooperate, we will be able to fight this and go through this together. We stay at work for you, you stay at home for us. Thank you.